Hello and happy July the 21st. I am Michael Ramone, your state representative for the 21st District with your community report. First, the number summary. There are 525 deaths in Delaware. There are 58 people currently in our hospital and 11 of those are in critical care. We have 13,746 COVID positive cases so far in our state, 144,601 COVID negative test results. There are 7,362 people now classified as recovered from COVID. And in the 21st Representative District, we have 0 deaths, 233 COVID positives, 3,187 COVID negatives, and 126 recoveries. Way to go, 21st Representative District. You should be proud of how well we're doing through this pandemic. Next week, we will be starting our campaign. Our community lit drops will be going out again. I will be walking the neighborhoods like I do every year after the session is over and dropping the phone cards with all the emergency numbers. I think they came in very helpful this year. A lot of people called me from those cards when times were tough and they needed some guidance. So I'm happy to do it again. I will be dropping, but I will only be dropping the cards. I will not be knocking on the doors. And if you'd like to stop me, please do so. And I will have a mask on and we can speak, but we will keep our safe space initiatives in place. We will also, with those phone cards, be announcing our tent event in each particular community. So that will be a nice purpose and another event to get together and to discuss and see if there's anything I can do to help you as residents of the 21st. The biggest thing I also would like to make mention of is tomorrow I will be honored by the Newcastle County Chamber of Commerce, and I will be awarded their 2020 Free Enterprise Award. It's a very nice award. The Newcastle County Chamber of Commerce is a very large organization in Newcastle County that represents businesses, and I am very honored to get this very prestigious award. The award is not given every year. The previous award winner of this award was a very good friend of mine, colleague, and co-chair of the Small Business Caucus, Quinn Johnson. So I am honored to be following Quinn, and it will be a great event. It is on. It's going to be a Zoom event. It's normally at the waterfront with hundreds and hundreds of people there. This year it will be a Zoom event. It's at 5 o'clock. If you're interested, go on the Newcastle County Chamber website and they will give you the details. And I also believe Stephanie is going to email blast that out if anybody's interested. This Sunday is our evening community coffee. It will be the second one now since the COVID outbreak. It's again at our home at 211 Nathan Court, but it will not be indoors. It will be an outdoors event once again. We will be exercising safe spaces. We will be spreading the chairs out, have hand sanitizer, we'll have masks, anything anyone needs. We kind of cut back on the food because we didn't want different people touching different things, but I'm sure we'll have something there for everybody to nibble on and drink. You may, once again, bring your own chair if you'd like. Like I said, we have a lot of room in the backyard, and we will have some chairs there also if you need. There's plenty of space. It starts at 7 and it ends at 8:30, weather permitting. If it is raining, we will not be having the event because we cannot move it indoors, so we will postpone the event. Starting August the 1st, our campaign signs will be starting to be distributed to the yards. Anyone desiring a campaign sign, just let me know. But we also just want to make sure everyone knows we're only putting the signs on private property and people's yards right now. We're not putting them at intersections and whatnot. I think it's a little early for that. We normally try not to start putting our yard signs out until August, and then we put the rest of the signs out at the beginning of September or in later August. That first wave of signs will go out fairly quickly in the month, and we will just drop them off at anyone's home who wants them. Just send me an email or text me, and we will keep a list with everybody's name on it. If you don't get it that first week and you think you were supposed to be getting one, please send me another text. Maybe sometimes they deliver to the wrong addresses. We've had a couple of mistakes like that in the past, or simply they do get taken or stolen or vandalized. That's why we try to bring them directly to people's homes so nobody would steal them or vandalize them. So if you want one, I would be honored if you would put one in your yard. I think it does show a certain level of support and credibility, and I hope that I've earned your support over the years with trying to do the best I can to help the people in the 21st District. This morning we had our Division of Health and Social Services, Secretary Walker and Dr. Rapate's legislative briefing. It was the Secretary's last briefing, and she said that many of the legislators were wishing her success in her new job in Washington, and made nice accolades about her performance and how well she's done to help Delaware fight this pandemic, which has been unprecedented. So some of the things that went on, the Secretary mentioned, although our daily COVID reports have ended, they are not sending them to us each day, as I would often send to you in our daily reports, the ones I would read to you. I would read right off of her sheets. They could still be accessed on My Healthy Communities Delaware, and there are more up-to-date live updates on that than what we were getting anyway. What you heard me read today was just what I just looked online and got before I compiled the report for today, and so they're very, very accurate numbers now, and they come out as soon as the report gets them. They're updated immediately online, so that's a good thing. And I will continue to during our community reports update those numbers to the current community report that you receive. Dr. Rattay mentioned an initiative to restart our schools, and in announcing the initiative to restart our schools, stated the testing and the tracing options that were being discussed are being discussed for the children and the staff at the schools. Remember, it's not just teachers. You got administrators, janitors, librarians, cafeteria help. You have a lot of different people in there. So what type of testing procedure will they have to help keep that safe? And what tracing will we have once we determine that there could be a situation that somebody needs to be tested or even quarantined? The legislators then asked a bunch of questions. They ranged from the new company that the Secretary hired to actually perform the function of the tracing. They were from the duties to report. Do you have a duty to report if you're COVID positive? Is that duty responsible for if a business sees someone in there who's COVID positive? What were all those responsibilities? The Secretary and the doctor made it clear that there really aren't any other than in the medical community. They did discuss a little bit about the prioritization of who gets tested, why, and when, and some were concerned that maybe it was getting too generous and too many people were being tested who had no symptoms. But again, with the asymptomatic environment, we felt that it's important we keep doing that. Questions and concerns about starting phase 3. Some were wondering why it hasn't happened yet. Others were wondering why it would happen. It was interesting, the discussion of what phase 3 actually is. It was thought by the Secretary and the doctor that maybe it really wasn't that many more things, but if you are one of the classifications in there, small businesses, restaurants, fitness centers, some others that are affected by that, or the crowd quantities that are adjusted when you get into phase 3 for things like churches and other crowds that would be happening, it all changes a bit. So there is something to be considered in phase 3, but I think they're trying to err on caution. Once again, my little 2 cents is let's not get to the point that our error and caution of a health crisis throws us into a deeper economic crisis or even a social crisis. Some other questions and concerns were the outbreaks in the prisons and what are we doing to test and check on that, the access to testing and the consistent access to testing, and being more proactive as opposed to reactive. Most of the answers that came out were that the Secretary and Dr. Rattay both felt we were doing well. They believe we are increasing testing is producing more of the COVID positives. So they tried to discount the fact that some of the other states put us on sort of quarantine, that they wouldn't let their people come back in without quarantine if they came to our state. But again, the doctor, as I was stating, having a lot of people testing positive for COVID only becomes a problem when those people are ending up in the hospital or in critical care or God forbid, dying. That's when it becomes more critical and more of an issue. Testing positive for COVID in a state at high numbers is actually a good thing, in my opinion, if there isn't a lot more people than going into the hospital. So it's the best way to get a vaccine without a vaccine. But the reality is, we just don't know what happens if everyone gets COVID at once. Just how much can our hospitals digest, and how much would the need be to digest? The hospitals and the critical care numbers for our COVID outbreaks it's the lowest since the beginning. We're doing awesome. Unfortunately, we're doing so well that our hospitals now are in a position where, hospitals aren't made to be empty. The business plan doesn't work. Hospitals are made to have a certain level of capacity and occupancy. And when they're too empty and there's a lot of hospital usage not being used, unfortunately, it becomes an economic nightmare for them, and some of our hospitals are starting to feel that pinch. The long-term care facility, as one of the biggest hotspots of the most deaths and the most spread of the virus, has actually been doing very well in the last weeks, if not month. I think we put a lot of precautions in place. I do believe a lot of it was socioeconomic. Some of the long-term care facilities that didn't have the resources to do some things that some of the others did early now have been provided those resources and the products they need in the PPE line to make sure they could be more COVID resistant. And I think that's very, very important. The expected big jump from when the high school children down the beach had the big outbreak never happened. And, the doctor said that may be because of the response. All this seems to be clearly displayed that Delaware is doing very, very well managing this virus. And next, we wait on the treatments and the vaccines for additional tools in our toolbox to help us continue to beat the virus in the fall. So if we can continue to manage the virus as well as we have this summer and have some more tools in our toolbox for the fall, I think we're going to be in a good position. The most important things the doctor had said to our ability to beat this COVID outbreak and manage it better is to have the ability to quickly react. The speed to react is the most important aspect. And our enhanced testing and tracing has helped Delaware stay on top of any of the hot spots or any of the outbreaks. So I did conclude once again with the doctor asking about my comorbidities, numbers breakdown on each death noted on the COVID in the COVID outbreak numbers. I just want to know how many other comorbidities, how many other causes of death that people have on their death certificates with the COVID, and we're still working on that, unfortunately. This is the 11th week that I've been asking, but it's not here yet. So that concludes our Division of Health and Social Services legislative update. Thank you for your support and your loyalty, and until next time, please stay safe and stay healthy.